I'm Kelsey Yunus, and I'm here to talk to you about the adjuncts used to create optimal oral health at home, or rather, which tools are beneficial for your specific mouth. This is for assignment 3 for PIDP 3240. I hope you enjoy. The biggest misconception with going to the dental office for your routine cleaning appointment is that you walk into the operatory and immediately the dental hygienist is going to ask when the last time you flossed. Everyone hates that question because, to be perfectly honest, does flossing really truly benefit everybody the same? Yes, if and only if you have close, tight contacts and you have the most optimal mouth, if you can get your fingers all the way to the back with no gag reflex and you can create that perfect C shape as demonstrated in this particular photo, then potentially flossing is the most beneficial adjunct for you. If majority of the previous list does work for you, except for that odd gag reflex or reaching all the way to the back of those tough molars, maybe something like this. A floss pick would be the best tool for you. The floss is attached to a stick, allowing for better access to reach to those tough areas. However, the downfall with this particular tool, creating that perfect C shape to reach all the way into each contact of the tooth, that bar gets in the way, so it makes it a little bit difficult. Yes, flossing can be great. However, by skipping flossing or skipping using a secondary tool, you are leaving approximately 2 out of 5 surfaces of each tooth. The importance to me as a dental hygienist is to make sure that I can find you a tool that you will use to gain the most benefit in removing that inflammation or bacteria present in your mouth. Having the perfect mouth with tight contacts is a lot more rare than you might think. Having a mouth like at least one of these type of spaces, which are called embrasure spaces, is way more common. Flossing is not ideal when facing a challenge like this because a piece of string floss would not allow you to effectively clean this exposed space. So now what? Which tool is the best option? One of the options are proxy brushes or interdental brushes. These are my all-time favorite tool for someone who either has braces or those type of embrasure spaces I was showing. Proxy brushes come in multiple sizes ranging from ultra tight to ultra wide, cylindrical, or tapered. They look like mini pipe cleaners and allow for ease of gathering plaque trapped in these open spaces. Here is a photo of a proxy brush in use in an interdental space in a premolar region. As you can see, you can see the coils, which is kind of like that pipe cleaner feel. When inserted into the open space, any soft plaque from everyday eating or bacteria buildup allows for easy removal. No need to reach those fingers all the way back in the mouth with these tools. This next one, my worst enemy, toothpicks. Yes, toothpicks do work well to remove the tough steak or popcorn kernel. However, they can do damage to your tissues when used incorrectly, which, to be honest, is most of the time. I strongly advise against toothpicks for a cleaning aid, not only for tissue damage, but they can rub off little pieces of wood and no one wants those splinters in your gums. The next photo here, I've shown a photo of a blunted papilla. So this could be caused from many things, but one is in fact the toothpick. Due to the wood not being ideal against tissue, overuse or incorrect use can lead to the tissue shrinking back or being cut into that triangular piece of tissue, as this is not a fixed piece of tissue, so it's very, very delicate. So what other options are there? Soft picks. Earlier I discussed proxy brushes that come in different sizes, but these soft picks are particularly small and it's basically like a toothpick, except the benefit of it is that it's rubber. Rubber is so much safer to use against the gums, and this tool can fit in your pocket. It comes in a tiny little packet and it's perfect for those on-the-go toothpick needed emergencies. Now, unlike proxy brushes that come in the multiple ranges of sizes, to allow for those bigger spaces, this soft pick are more of those types of closer, tighter contacts, as it only comes in this one small size. They're great for the lingual bars that you would get placed after orthodontic work, or just as mentioned, those emergencies that we just need to get that piece of food out. This is your tool. Another tool on more of the gadget perspective is this machine like this, which is shown in the picture, called a water pick. Water picks are a great tool to allow for removal of biofilm, which would lead to a decrease in inflammation. Again, needing embrasure spaces or deep periodontal pocketing is the ideal mouth for this type of aid to be used. Here is a photo of some of the types of tips that can come with a water pick. You've got your pointed, your brush head, your rubber tip, just a steady stream of water. All of these tips are case specific for the goal that we are trying to reach. Are you aiming to remove the debris, or are you aiming to reach into that one tough, deep pocket you've got in the back molar? Knowing that, you can pick your appropriate tip. Even if you don't have the deep pockets, occasionally a water pick can be used for removing the debris like shown in this photo. Although this photo is dramatized, it does give you an idea of the power behind a water pick and how it can remove the tiny particles of debris that is trapped in the mouth that is unable to be removed through conventional brushing. Here's your dramatized photo. The next topic, braces. Braces are the most challenging appliance to effectively clean around due to all the presence of the wires and the brackets and everything in your mouth. Although braces are slowly becoming more prevalent in adults, generally the population demographic that we are working with is that early to late teens who, let's face it, don't really put the time into cleaning their teeth. It is nearly impossible to expect your patients to floss unless they're a dental professional or they have all the time in the world. And patience, mind you, to use something like this in this photo, which is a floss threader, to clean it properly. However, any of the adjuncts we've been discussing will work great, specifically water pick or the proxy brushes. With all of my previous references to periodontal pocketing or healthy gum tissue, I've decided to include this photo so it gives you a better reference point. When you have a look at your screen, on the left side of your screen, you see a nice tight gum tissue that's right up against the tooth. There's no visible bacteria. Everything looks nice and healthy. When you look on the right side of your screen, you can see the gum tissue is pulled away. You can see the inflammation and the bacteria in the pocket. That's what we need to clean out. Ever wondered if mouthwash is really beneficial? It is true, in fact, that adding a Listerine mouthwash does reduce biofilm present in the mouth. Listerine brands do have 3 essential oils that are proven to remove and kill bacteria that's present in the mouth. The benefit of that full mouth clean. So, how do you use it? Simple. Rinse with a Listerine product for 30 seconds twice a day, morning and night. This maximizes your benefit. I do recommend Listerine Zero out of all the Listerine products as it does not contain alcohol. That burning sensation that Listerine products taste like, it does come from the alcohol ingredient, which is 100% a pure myth that it does a better effect if it burns. Overall, as a dental hygienist, I want to work with you and, more importantly, for you. My goal is to find you the best tool as an individual that you will use and benefit the most from. So whether you are an avid flosser or not, I know that I can create a home care routine that will work for you. We just need to find the tools that you like. Thanks for listening. Hope you enjoyed and I hope you learned something. Here is my references.